Welcome back, Chronics, and thanks for joining me. Today we're talking about thumb, wrist, and hand pain, but we've all heard surgery doesn't go well for EDS patients. That is not true. Turns out, depends on the surgeon. This orthopedic surgeon is in Seattle, and his name is Dr. William Erickson, and he operates on 2 to 4 EDS patients a week. We have joint instability and peripheral nerve problems, but our nerve tests come back normal, because of course they do. We have thumb problems. If you just press right here, you can almost dislocate it on most people. This will progress to arthritis because the cartilage wears off prematurely. By 55, 50% of us have this problem, and this is what it looks like on an X-ray. You can stabilize the thumb using a tendon to create a new ligament. This surgery is called the Eaton-Littler procedure, and I guess it's been around since the early 70s, so everyone should know how to do it. Dr. Erickson does about 150 of these surgeries a year. If you just do the operation on the ligament, it won't work without fusion, and fusion's not great for us because it creates weight on either side of our thumbs. But he does a salvage procedure. He removes a bone in the thumb and then uses a tendon to suspend the bone so it can't move around as much. He says this surgery can work well, and he gets about 80% of relief with his patients. This is what the X-ray looks like when that bone is removed. You can see the anchor holding the tendon to the bone. We can also get large bone spurs in the index finger. But if you take the bone spur out and reattach the collateral ligament and fix the nerve problem at the same time, it works great. We also have super bendy thumbs. And bendy thumbs get arthritis. But Dr. Erickson says if you make a small incision along the creases of the knuckle and to remove the bone spur and the swollen lining of the joint, pain goes away. If there is clicking in that joint, a tiny little bone called the sesnoid can be removed. Content warning, this is a gross picture. Also on the underside of our wrist, there is a bone called the pisiform, and it is often loose in Ehlers-Danlos patients. Slide content warning. Here is a photo of an EDS patient who had both of his pisiforms removed. The pinky, the index finger, and the thumb have 2 tendons going across the joint, and these can move away from each other. He says you have to move the fingers and make sure the tendons are in balance. Surgically, the only repair is to open up the knuckle and tie the 2 tendons together. With the thumb, the extensor pollicis brevis gets moved to the next bone, so it pulls the next bone up. This is another issue that's common with us EDSers. This causes aching pain along the tendons, but the lining of the tendon can be removed. Not many other doctors know about these options. No kidding. These are indications for surgery, even though I'm sure you've heard physical therapy is the only way to go. Okay. A lot of us get unnecessary carpal tunnel surgery, which doesn't work because the pain has to do with the median nerve in the elbow for us. We really need to be dealing with an educated surgeon. Thank you so much for joining me, and remember, don't give up, hang in there, and don't take crap from anyone. I will see you guys next time.